Welcome to Module 8B, Causes of Vaginal Pain which need professional intervention. These are the difficult ones, issues that are not likely to be solved by home remedies or changes in your lovemaking patterns. The most important thing to know about this group of causes is that they are true medical conditions. You did not cause them, and they require treatment by a qualified medical professional. Here's a partial list of the conditions I'm talking about. First of all, yeast and urinary tract infections. Here are some of the symptoms that mean that you need to see a doctor as soon as you can. If you experience burning around your genitals, itching, discharge, dark or bloody urine, rash, painful urination, or pain with intercourse that you haven't had before, please see a doctor as soon as you can. Many infectious conditions can be treated quite quickly, and they can get worse if not treated. A few resolve on their own, but the safest thing is to see a doctor so you know for sure what's wrong and can act accordingly. Taking good care of your precious body is a spiritual and practical thing to do. Secondly, we have sexually transmitted diseases, STDs. Some of these can cause pain or irritation to delicate tissues, and most can be easily passed to any sexual partner. If you have unexplained symptoms or any reason to think you may have been exposed to HIV, herpes, chlamydia, or other STDs, it's crucial to see an experienced doctor as soon as you can. Early treatment for many of them makes a big difference. Abstaining from intercourse if you think you might pass on an STD is the right and best choice. The next best choice is using condoms in uncertain situations. The next major cause of painful intercourse is vulvodynia. It's an unfamiliar word to many people. It means pain in or around the vulva, a woman's genital area. Pain that can be caused by any pressure, even by prolonged sitting and by insertion of anything into the vagina, especially the penis during intercourse. Millions of women around the world have this condition. A variety of vulvodynia is vulvar vestibulitis, inflammation of the skin and glands around the vaginal opening. That kind of inflammation can cause any touch to a woman's genital area to be extremely painful. Both vulvodynia and vulvar vestibulitis are medical conditions that cause painful intercourse. But unfortunately, very few doctors specialize in treating all aspects of this problem. Successful treatment of these conditions takes much more time than most physicians have to spend with you. As I researched this issue, I found to my surprise that the professionals of choice for painful intercourse are often physical therapists who specialize in women's health. Ideally, women struggling with this problem would have a team of professionals, including a gynecologist and a sex therapist, who could assist a couple in learning to support each other in this process. But the most important member of the team would most likely be the physical therapist, who knows how to work with pelvic floor problems, including teaching you how to stretch certain muscles, how to massage trigger points, and how to use a series of dilators until the vagina can be penetrated without pain. Most women will not be able to arrange this ideal treatment team situation, and many will not be able to find or maybe to afford any experienced professional to help. If you are one of those women, a workable alternative is to do a self-treatment program at home. Physical therapist Heather Jeffcoat wrote a book and created a self-treatment protocol because her patients were unable to find doctors who could treat them fully. Her book is called Sex Without Pain, a self-treatment guide to the sex life you deserve. Good title. Other physical therapists have also written self-treatment guides, often based on a lot of experience with patients. Several of these books are listed in the resource section below. The fourth cause in this category is vaginismus. This is a well-known condition in which the vaginal muscles involuntarily contract and remain shut. Girls and women with this situation cannot even insert a tampon. We don't know the exact cause, but we definitely do know that vaginismus is completely involuntary, not something a woman chooses at all. What to do about it is a big question. The short answer is to see an experienced specialist for help if you can, either an MD or a physical therapist with an advanced degree and extensive experience working with female sexual pain. Treatment usually involves both education in vaginal anatomy and a gradual process of insertion of a series of dilators, starting with a very small one and gradually increasing their size. Vaginismus can definitely be cured, but it almost always requires treatment. Number 5. The last cause of vaginal pain that I'm going to talk about doesn't really fit in either the fix-it-yourself or see a medical professional category. That causes sexual trauma. That trauma can come from a whole range of behaviors, from unwanted exposure, uninvited touching, unwanted nudity, all the way to rape. As a therapist who has seen many clients with these kinds of experiences, I can say that almost all of them have long-term effects. Those effects can be healed. So important to know that. But it usually takes therapy, not just time. And there's always a way to find a therapist, even if you don't have much money. See the end of the resource section for advice on this. So now that we know the causes of these more serious kinds of painful intercourse, let's look at the solutions, the action steps. Number 1, first of all, find a path to healing that's based on understanding that sexual pain is a physical problem, not a psychological one. If you can find an experienced doctor or physical therapist who specializes in this area, by all means do a trial with that person if you can. Action step number 2. Consider researching and choosing a self-treatment program. Several choices are listed in the resource section at the end of this module, as they were after 8A. Action step 3. While seeking or beginning self-directed treatment, get creative about having sensual contact with your partner in other ways. Make out by just kissing and stroking each other. The possibilities are endless. Give and receive oral sex or hand pleasure with your partner. If it's not painful, experiment with having him gently stroke or lick or suck your clitoris. For mutual pleasure, you can reciprocate. 4th action step. Begin to form the habit of a few minutes of intimate touch as close to every day as possible with your partner. Any kind of intimate touch. 5th step. Try having a whole lovemaking session where pleasuring each other orally is all you do. 6th action step. If you're able to see a doctor, ask whether a prescription for supplementary estrogen is advisable. The 7th and final step is described in more detail in Module 2 on female orgasm. But here's the summary. The woman lies down, only partially nude, with her genitals exposed, and the man strokes her clitoris gently with a lubricated finger for 15 minutes by the clock. This is a powerful exercise. It can be reversed. The man receives while the woman gives. It's best to separate this exercise from other lovemaking rather than thinking of it as foreplay. It's a special form of intimacy that you can do often. Finally, keep in mind that many women and men have pelvic pain of one kind or another, and many have found healing. So I'm encouraging you to take heart and believe that one way or another, the problem of painful intercourse can be solved.